You wake up in the morning short of breath, sweaty, with a sharp pain in your chest. You frantically tell your spouse to call 911 as the symptoms continue to get worse. She activates the emergency response system as you struggle to breathe. The EMS workers arrive at your house in 6 minutes and have you loaded on the ambulance within 3 minutes. They confirm you're having a heart attack and provide you oxygen, a monitor, an IV, and have you chew up an aspirin. You arrive at the hospital within 5 minutes since they drove with lights and sirens. You pull into the emergency room bay and there are 4 other ambulances blocking the lane. Precious minutes pass as you're waiting for your turn to unload, and then all of a sudden you lose consciousness and your heart goes into an unstable rhythm. What no one understands is in those 4 other ambulances is a patient with flu-like symptoms, a urinary tract infection from the nursing home, a patient with a toe injury when they ran into their dresser in the middle of the night, and a chronic breathing patient with pneumonia. So from the time you activated the EMS service to the time you arrive at the hospital was 14 minutes, but those 7 minutes you waited to unload may have just cost your life. To let you know a little bit about myself, I'm a registered respiratory therapist with 24 years of experience, and I currently work in the emergency department at St. Thomas Rutherford Hospital. Today I'm going to discuss why hospital emergency rooms should have the right to refuse non-emergent patients. I'll also provide solutions for treatments to non-emergent cases that are flooding our ER today. Before I discuss those solutions to treat non-emergent patients, first, let me discuss why hospital ERs are unable to refuse non-emergent patients. According to the Emergency Medical Treatment and Labor Act, or EMTALA, the Centers for Medicare and Medicaid Services states that a hospital that has an emergency room must treat all individuals that come in the ER regardless of the ability to pay. They should provide appropriate medical screening within the capacity of the ER, including all ancillary services routinely available to the ER to determine whether your condition is emergent or not. Next, here are some statistics that show the wasted cost and the overuse of emergency department visits. According to New England Health Institute, emergency department overuse is responsible for up to $38 billion in wasteful spending in the United States every year. Laura Dydra of Becker's Hospital Review showed that in 2016, 136.3 million reported ER visits in the United States, with only 16.2 requiring hospital admission. Truven Health Analytics analyzed insurance claims data for more than 6.5 million ER visits in 2010 and found only 29% of the ER visits actually required emergency care and were not preventable. According to William Kirkpatrick of Total Access Medical, the average cost of an emergency room visit is $767, while an office visit to a primary care physician costs up to $187. This leads to potential waste of $580 a patient. So let's now talk about some solutions to non-emergent care. Virtual visits allow a patient to connect with a doctor using a smartphone, tablet, or computer for minor healthcare symptoms. Some of these providers offer 24-hour-a-day, 7-day-a-week care. This would allow a patient to get prescribed treatment for around $40 per visit. Primary care physicians can manage chronic health conditions, minor injuries, and give preventative care patients require. This would allow the patient to get medications for ongoing health problems, proper follow-up and preventative care. This would also reduce the amount of frequent flyer visits to the ER. Average cost of this service is $58. Urgent cares provide first-come, first-served treatment to non-emergent cases and provide diagnostic testing such as x-rays and blood work. These clinics have extended hours that primary care physicians do not and offer weekend visits as well. Average cost of this service is $125. Fast track options in the ER have been found to be very effective at my hospital. We have 15 beds dedicated to non-emergent patients and they stay full the majority of the time. We only had the option available from 7 a.m. to 11 p.m. However, we're looking into extending that care 24 hours a day. Average cost is $275. In conclusion, there are a high percentage of non-emergent patients flooding our ER today, causing a delay in health care for patients with true emergencies. Due to EMTALA, the hospitals do not have any right to turn any patient away seeking ER treatment. Although we push them back with long wait times, they continue to flood our hospitals seeking non-emergent therapy. By educating the public on virtual visits, establishing them with a primary care physician, and utilizing urgent care and fast-track options, we can decrease these numbers dramatically to avoid some of the wasteful healthcare costs. Unfortunately, something dramatic as death of a loved one has to occur before people will open their eyes to the abuse of this system. I see this look from family members on a nightly basis and frequently get asked the question, why is that person here? Are they even sick? They look fine, as tears roll down their eyes. With all the healthcare reform talks going on in Washington today, EMTALA needs to be at the top of the list of subjects for reform so we can control the wasteful loss of hospital resources. I challenge you today to educate yourselves on what a true medical emergency is and when to utilize the hospital ER. Thank you for your time.
Well, that was interesting.
Thank you.